A pulmonary embolism is a blood clot in the blood vessels of the lung. This happens when a blood clot in another area of the body, often your legs or your arms, moves through the veins to your lung. A pulmonary embolism restricts blood flow to your lungs, lowers oxygen levels, and increases blood pressure in the pulmonary artery. Without quick treatment, a pulmonary embolism can cause heart or lung damage and even cause death. Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we are going to be going over pulmonary embolism. So this is just a quick 5-minute mind map of things that you as a student nurse or a nurse just going into the field should know about pulmonary embolisms. Okay, so a pulmonary embolism is a blood clot in the lungs. So the things that increase your risk of having a pulmonary embolism is immobility, obesity, deep vein thrombosis, dehydration, birth control, post-surgery, and postpartum, so after having a baby. What are the signs and symptoms of a pulmonary embolism? So increased heart rate and increased breathing, restlessness, sudden sharp chest pain, in distress, and they may have a pink foamy cough. Okay, if you think about it, when a clot is in your lungs, it's blocking off air. So you can look at the signs and symptoms and kind of connect it, right? You can see how you have a blood clot and you have these symptoms. Okay, it's affecting your lungs. So whether you have a test to write, or your final exams, if you really think about the problem, so a pulmonary embolism, a clot in the lungs, what are going to be the related signs and symptoms, and you can really think it through and make it all make sense. So it also makes studying a whole lot easier. Next, we have diagnosis. So how are we going to diagnose a pulmonary embolism? Through a CT scan, a positive VQ scan, increased D-dimer, chest x-ray, and pulmonary hypertension. So if we're looking at arterial blood gases for pulmonary embolism, we will have a low PCO2, we'll have a low CO2, a low oxygen. We're going to have a high pH because we're retaining that CO2. So next we have treatment. So how do we treat a pulmonary embolism? So number one, we want to prevent them from happening in the first place, okay? So moving around and hydration. This is the best prevention of a pulmonary embolism and clots in general, because normally, like I said, they start in the deep veins, and when they break off, they end up in the lungs, okay? Oxygenation, routine arterial blood gases, pain medications, anticoagulants. The patient will be on bleeding precautions. We may need to put a patient on bed rest to prevent a clot from dislodging. Possible surgery, raised legs, and TED stockings to the unaffected limb. So that's all I have for this video, guys. I hope you did find this 5-minute mind map very helpful. If you are looking for more of these mind maps, please check out my Etsy store. I'll have it linked in the description below. But once again, that's all I have for this video, and I hope to catch you in my next one. Bye for now.